When is a parent born? When your world changes in a moment? Nani? Or when the moment is celebrated by all? When you start learning again? Or with a new role? Is it your child's first breath? Or is it just a feeling? Parents are born when they fulfill a responsibility.
Your child's umbilical cord blood can provide protection from 80 life-threatening diseases. Keep it safe with Asia's largest stem cell bank, Cordlife. One chance, one choice.
Hi everybody, a very good morning and a very warm welcome to all of you lovely mamas and daddies if you are joining us this morning for the session. So thank you so much. You have taken time, apne Saturday morning you have taken out time for us to attend this webinar. Let me start with a very quick introduction about myself. My name is Sonali Shivlani and I'm from Mumbai. I'm a pregnancy and postnatal consultant. So today's topic is actually in both my areas. One is going to be about pregnancy exercises, and then we're going to talk about breastfeeding. And I love both of them. These are both favorite topics for me, right? So we're going to be talking about all of these things. If you want to try some of the postures and positions, then if you have a yoga mat, please get that along. Make sure you have a bottle of water, and I know it's early morning, so if you have not eaten your breakfast, then quickly get yourself a snack so that you can also eat while you are listening to the session. And one more thing that I would just like to point out is that everybody has been kept on mute. You cannot speak. And because of that, we want to record the session, and we will be sharing the recording with you. So just make sure that whatever questions you have, put it in the question box. So put all your questions in the question box. That is going to help us to answer all of your questions, just before we close the session. So get all these things organized, your snacks, a bottle of water, maybe a yoga mat, just to try 2-3 positions and sit back, relax. Keep all your questions handy so that we can answer them for you. Okay, so I'm going to give you 2 minutes till you get all these things arranged, and then we'll get started. All right, lovely. I think everything must be all ready and organized by now. So just sit back and relax. I would like to start with this session by saying a very quick thank you to Dr. MEETA NAKHARE for giving us this opportunity to interact with all of you. I understand, it's the pandemic time, it's COVID situation. We don't want to be in large groups. We're avoiding meeting people, social distancing. It's making pregnancy so difficult, isn't it? Because one of the most important things about pregnancy is, I meet other mothers, I enjoy with other mothers, I exchange experiences. And I can't do that now because of the social distancing. So therefore, thanks to Dr. MEETA for giving us this opportunity so that we can share this information with you in a safe manner. And we don't need to bring you out of your homes for this. The other thing that I would like to also mention is that this entire platform of GoToWebinar has been arranged for us by Cordlife. So Cordlife is one of India's leading stem cell banks, and it's been a great initiative since the start of the pandemic. We've been having regular webinars for all the parents to be, so that all of this content, information can be shared to help make your pregnancy safe and healthy. Right. So thank you very much, Dr. Meeta. Thank you, Cordlife. And now let's get started with talking about the session. Again, just as a reminder for those of you who have just come in, your microphone has been kept switched off because the session is being recorded, which means you are going to get a recording of the session, and that you can use for reference later also. Along with that, if you want to make some notes, please do. That's just fine. In the question box on your dashboard, you can put in all your questions, and I'll make sure that I answer them before I close the session today. Another thing that I would just also like to mention here is that towards the end of this session, I'm going to be telling you about a gift voucher, right? So there is a little gift for all of you lovely mamas, and this will be shared with you at the end of the session. So don't leave. Make sure that you stay with us for the entire 1 hour period. Okay. So my first topic, opening topic for today is prenatal exercise, which is pregnancy exercises. And let's get started. The first and most important point over here that I would like to share is the benefits of exercise to the mother. So mothers, during pregnancy, we are generally told that you can do anything, you can rest, you can relax, you can eat anything. All of these are things which are shared with mothers during pregnancy, and we tend to become lethargic, especially in the first 3 months. Absolutely zero exercise. So even if a mother has been very active and regular, the moment the pregnancy test comes positive, everyone in the house starts telling you, now rest. Now don't do this. Now just relax, right? But exercise can actually be really, really helpful for a lot of reasons. The first and most important is your back pain, and of course other discomforts. So other discomforts could mean cramps in the legs, acidity, bloating, sagging breasts. All of these can also be discomforts, and exercise can help to reduce that. The endorphins that are released when you actually do a workout are going to help to boost your mood and also your energy levels. So a lot of times when you first start exercising, you feel a little tired. That's normal. But as you keep doing it over the next few days, you will realize that your energy is actually becoming better. You can actually do more during the day because pregnancy does make you a little slow and lethargic, isn't it? Mothers find they can also sleep better because their body is just much more, relaxed than anything else. So during pregnancy, because of the growing weight, because of other discomforts like frequent urination, etc., you tend to wake up a lot, isn't it? But when you exercise, the sleep that you get is going to be more of a deep sleep. And that is very important to make you feel rested. It will help to prevent extra weight gain, which is definite bonus. We don't want you to kind of, have to struggle hard after you deliver to lose all that pregnancy weight. We definitely want to have sexy moms. That's really important. It will help to increase your stamina and muscle strength, which is very important to hold the baby, right? Because the baby is growing and your body has to sustain that extra weight. So your muscles have to become stronger. Pregnancy complications are reduced, and some of the words that you may have heard about pregnancy complications is gestational diabetes, pregnancy-induced hypertension, thyroid malfunctions. So all of these are big words that we hear, and it can help to reduce all of this. Labor and delivery can be smoother. So I'm not going to sit here and say that you're going to have a painless labor and it's going to be absolutely quick. No, that doesn't happen. Labor is generally long and labor can be painful. But if it is if you've been exercising, your body is, it's been stretched properly, it's nice and strong, then you don't feel the pain as much, right? And it can move a lot more faster. So your overall experience is much better. It also results in a faster postpartum recovery, which is very, very important as far as mothers are concerned, right? The first thing that you have to remember before you start, and this is very essential, is that always check with your doctor, right? If you, whatever the case may be, every pregnancy is different. Even though most pregnancies are uncomplicated and we don't have any emergency warning situations, but some pregnancies could have that. You might have a low-lying placenta, maybe you're carrying twins, maybe you've had previous miscarriages. So always speak to your doctor before you start. And it's not that you speak once to the doctor. Every visit that you go, you must always ask the doctor again and again and again. So don't be afraid, don't be embarrassed. I mean, I've asked once, why do I need to ask again? Don't do that. It's perfectly okay to ask multiple times, because that is very important as far as your overall health is concerned. Pregnancy can change. You know, you may have got permission in the 5th month, but something came up in the 7th month and the doctor says, no, you know what, let's slow down, let's not exercise for a few weeks. Let's see how things progress, because we definitely don't want preterm labor. We don't want the baby to come early. Before we even talk about exercises, the first thing that requires very good attention is your posture. Now, during pregnancy and otherwise also, actually, you should follow a good posture every time, but pregnancy also makes it much more interesting to prevent backaches and etc. If you look at this mother who's sitting on the chair, right? And a lot of us who are working moms, even now, like right now, I'm sitting on a chair. So I should take care of my posture while sitting, because that's going to be my longest duration of posture during a day. So even if I'm a working mother or a non-working mother, and even if I'm watching television or I am, working on my laptop, I should not slouch. So if you look at the mother on the left, she's slouching. She's not taken full back support. So it's important and essential that she takes full back support for her back. And that is essential and that is important to keep in mind. So your posture should be like the woman on the right with full back support. If you like, you can keep a small pillow tucked behind your back, which will help you to kind of, maintain that posture much better. Your feet should be on the floor. They should not be dangling like this, because that also causes a little bit of strain on the back. So keep your feet flat on the floor. If there is any kind of, the chair cannot be adjusted, the couch cannot be adjusted, then you should keep a small stool below your, feet, which will help you to maintain your posture. The next thing that is there in mind, that you have to keep in mind, is your standing position. So when you're looking at your standing posture, if you look at how a pregnancy progresses, okay? So let me show you with my hand to make you understand better. For a normal woman, when she is standing, there is a small little curvature in your lower back, right? So the back kind of looks like this, which is normal. Now, as pregnancy progresses, the weight increases over here. And because of the weight increasing in the belly, your posture becomes like this. So if you can see, the back gets an additional curvature in this fashion, correct? Now, once the back gets an additional curvature, there's a lot of strain over here, and this causes discomfort to the mother and causes the back pain. So the first thing you must always do is stand up erect. Kind of make a conscious effort to make yourself erect. So you tuck your abdomen in, you pull your buttocks in, and you keep your spine nice and straight like this. As you can see, my cursor is moving across the back of the mother. The other thing that also happens is that my breast size changes. Now, because my breast size changes, the extra weight over here will make my shoulders start hunching forward like that, right? So when my shoulders hunch and my lower back is kind of straight, the entire back gets compromised and there's a lot of back pain. So what should we do? We should stand tall and straight. We should always try to push our shoulders back, and we should try to kind of, stick our chest out. That should be our tall and erect standing posture. Now let's start with some simple exercises, and while I'm showing you the pictures, I will also explain how you have to do them. And while you're sitting there, you can try about 3 to 4 counts with me, so that you get a little feel of how they have to be done. And then you will speak to your doctor, get permission, and then get started. Okay? So the first one is neck rotations. It should always be done. All these exercises should be done slowly. There's no rush. There's no hurry. Okay? So do them really slowly. Do as many counts as you feel comfortable. Start with a few and slowly start increasing the counts. Now, neck rotations, 8 to 12 counts, maybe 16 counts or maximum on a daily basis is more than enough. It improves circulation to your head, which will reduce dizziness, headaches, all of those kind of discomforts. Additionally, it also helps proper functioning of the thyroid gland. So that's very, very important during pregnancy. All right. So let's try this. We'll slowly drop our chin to the chest. Left ear to left shoulder. Back of the head to the back. Right ear to right shoulder. And chin to chest. And then we're going to reverse it. Right ear to right shoulder. Back of the head to the back. Left ear to left shoulder. And chin to chest. Right? So that is something which will help you with all of these issues. And you should practice this on a daily basis wherever. And this is also an exercise which even mothers who are on bed rest can do really safely. The next exercise is wrist rotations. This is very, very helpful for mothers who are working on the computer a lot. And sometimes mothers who feel numbness or swelling in the fingers, especially when they wake up in the morning, you should do your wrist rotations also. Because what happens is when we sleep, we tend to sleep on one side, the hand gets completely compressed, and this can cause reduced circulation overall. One of the things that I would definitely suggest is that make sure that your finger rings are fitting you like this all throughout your pregnancy. Your weight gain should be in the abdomen, in the breast, and in the buttocks. Your fingers, your face, your nose, all of these things are not supposed to swell up. Okay? So finger rings should be fitting you well. And if you are getting swelling, then you should report to the doctor. If your fingers are becoming fat and there's no swelling, then you should worry because you're gaining unnecessary weight in the wrong places. Okay? So let's see how we're going to do this. The first thing you're going to do is simply stretch your hands out nicely like this. Make a fist tight, stretch, make a fist. Even if you are on bed rest, you can easily do this one. Okay? And then circle those wrists first in one direction. Notice that I'm doing it so super slow. All right? And then reverse it. 2, 3, and 4. Wonderful. Okay, so as I said right in the beginning, all of these circulation based exercises, 12 to 16 counts every day is more than enough, and you can choose the time of day that you're comfortable in doing them. The same way that we did the wrist rotations, we're going to do the exercises for our feet also. So wherever you're sitting, just stretch your legs out and point and flex. Now when you're doing this, can you feel this in your calves? I'm sure you can. So this is great for those cramps. This is great, for that pain in the legs that you're feeling. Maybe after the whole day, if you've been standing, this is going to be really, really helpful for you. Okay. And then you can do the ankle rotations, which will help you with any kind of swelling or edema in the feet. So just circle that ankle first in one direction and then in the other direction. Okay, so that is something that you can do as a regular practice for your feet. Again, 12 to 16 counts every day is what would be highly recommended. The next exercise that is recommended, and this is for labor preparation purposes, you can start doing this from 24 to 28 weeks of pregnancy, and you are going to do this on a mat if possible. Otherwise, if you're doing it on a couch or on the bed, then you can just do it as a sitting posture. So it's really simple. You're going to bring your feet together as close to the pelvis as possible, and your knees have to be as low as possible. Okay, you can sit like this to watch TV, to kind of, maybe talk on the phone. If you feel tired, you can stretch your legs out, which means you can actually do this kind of position, the sitting position, for 10 minutes, then take a break, then do it again for 10 minutes and take a break, and then kind of keep doing it throughout the day. So there's no fixed timing for it. But when you want to do it as an exercise and you're doing it on the mat, you're going to flap. So you flap up and down, up and down, right? So that's your exercise. And you can change the flaps to making it more faster, just to give yourself some kind of a variation. When you're doing it as a flapping exercise, you start with 8 to 12 counts, but you can increase this to 16, 24, and even almost 48, that is 6 sets on a daily basis. The cat and camel pose is excellent for back pain. And what you have to do is get onto all fours. And again, this one also please do on a mat so that your body is stable and steady. So get onto all fours. Your arms are below your hands, below your shoulders, and your feet are, the knees are hip distance apart. So you'll start with a tabletop position where your back is completely flat. Then you're going to slowly arch your back, look up at the ceiling, hold that position for 3 counts, and then round your back out like a camel hum, look down at your navel, and hold that position for 3 counts. Once again, repeat it. Arch your back, look up at the ceiling, make a cat-like arch position, and then hold for 3 counts, and then round your back out, look down at your navel, make a nice camel hump, and hold for 3 counts. So this is a great stretch for your lower back as well as your upper back. Honestly, I've had mothers who've also done this kind of exercise sometimes just before sleeping, because they get this, feeling of back pain just before they sleep, and then they start doing this as an exercise. The pelvic tilt, again done on a mat, is very good for core strengthening. So it strengthens your back, it strengthens your abdomen area, and it also strengthens your buttocks. So lie down flat on the mat, place your feet on the floor, the knees are pointing to the ceiling. You can use your hands for support and slowly raise your buttocks off the ground as high as you can go. Don't hold your breath. Hold it there for 3 counts and then gently come down. And then repeat again. Raise your buttocks. Hold it up there for 3 counts. Squeeze the buttocks and slowly release. And let's try it one more time. Raise it up. Squeeze the buttocks. Hold it there. 3 counts. And then come down. Right? So this also exercise is excellent to help you strengthen your core. Core strength is very important during pregnancy because it actually helps you to support the pregnancy. It also helps you to deliver the baby a lot more easily. The next exercise is also from labor preparation perspective, which we call the leg raises. Now, I would recommend that you do this exercise on a mat. Lie down on your side, and of course we're going to do both sides for sure, but lie down on your side, fold your lower leg. When you're folding your lower leg, you stabilize your body, so your body doesn't wobble as much, okay? So the lower leg is folded, the upper leg is straight, and then what you're going to do is raise it up to 90 degrees, bring it down, raise it up to 90 degrees, bring it down, raise it up to 90 degrees, and bring it down, right? So we're going to start with 8 counts, and we're going to go and do this. Mothers who are experienced and who've been doing this for a while, they easily do about 32 to 40 counts for each leg on a daily basis. And you can start doing this exercise between week 24 to 28 of your pregnancy, and you can do it all the way till you deliver. But of course, again, gentle reminder, make sure that you're always checking in with your doctor that you're allowed to do all sorts of exercises during pregnancy. Very, very famous. These are our pregnancy squats. Everybody must be asking you to do that. And yes, definitely, if pregnancy is healthy, we can start doing squats. Because the abdomen weight is increasing, mothers don't have a proper center of gravity, and therefore they might actually, fall. So they might actually fall and, wobble a little bit, and etc. So that is something which you should be very careful about, and you should take care, right? So the reason why in my picture I have shown a firm chair, a nice strong chair, is because that can be your support to make sure that you don't fall. Alternatively, you can use the couch. You can kind of support yourself with the back of the couch, or you can also support yourself against a wall. If your husband's available, you can use his firm, strong shoulders as well. So that's also an option and an alternative that you can use to ensure that you do your squats regularly. So what we're going to do is we're spreading our legs really wide apart, and we're going down with our backs tall and straight till our thighs are parallel to the ground, right? And then slowly come up. Don't lock your knees, and then once again go down and come up. And you're going to do this. We start with about 8 counts, and we slowly increase this to 12, 16, 24. And then, of course, as I said, experienced mothers, they end up doing sometimes about 80, 90 squats every day as well. The next exercise that we're going to talk about is deep breathing. Now, deep breathing, even though it sounds that like a lot of, oh, it's so easy and etc., but it's very important that you do it on a regular basis, because it helps to build your lung capacity. It helps to, build up your abdominal strength. So that is something that you should do on a regular basis, right? So let's do this together. Close your eyes. Take a deep breath in, all the way till your lower abdomen. Exhale. Once again, take a deep breath in, all the way till your lower abdomen. Exhale. One more time, deep breath in, don't hold your breath anywhere. Exhale. All right. Ideally, you should be doing about 40 to 50 deep breaths every day. And the idea is that it's a good idea to do it in a non-air conditioned environment. Do it, with an open room first thing in the morning, so that the air is a little fresh. And you can again, even if you're on bed rest, you can do this exercise on a regular basis. Let's talk a little bit about Kegels, right? Kegels are exercises for your pelvic floor. And let me show you a very quick picture to help you understand this. So if you look at this, this is your pelvis area. That is the area which is right around your buttocks. This is called the pelvis area. As you can see over here, the pelvis area has 3 openings. So this is your bladder, which is shown in yellow. In this pink, we are showing the uterus, and then this gray area is your bowels, right? And this red muscle that has been shown over here, those are your pelvic floor muscles. So what you can see now and understand is that the pelvic floor is like a hammock, and it supports all of these vital organs. But over and above that, it also supports the organs above this. So your abdomen, your intestines, everything is being supported by the pelvic floor. So if the pelvic floor is strong, that is going to result in obviously a lot of benefit overall. In fact, a strong pelvic floor results in ensuring that you have less back pain because it's also connected to your spine, as you can see. It doesn't have sagging abdomen post delivery. So all of these are benefits that you have of a strong again. Yeah, apologies for the network loss. There was a network connection issue. So let's go back to trying and doing the Kegels again. What you're going to do is imagine that you have to stop the flow of urine and hold those muscles, pull your pelvic floor in and release. Once again, hold and release. Hold, release. Hold, release. While you're doing this, make sure that your breathing is normal and you do not tighten your abdominal muscles. This is going to help prevent urinary incontinence during pregnancy. It will prepare you for the delivery, and it will help the vaginal muscles to go back in shape after you deliver as well. Okay. So how many are we going to do? We're going to do about 100 to 150 Kegels on a daily basis. I know it's a lot, but you will do this during pregnancy. You will continue doing this after you deliver. And actually, you should do this all your life, because the pelvic floor muscles will help your uterine prolapse or bladder incontinence issues even when you're an older woman. So whatever questions you may have related to the exercise segment, please do put them in the chat window. And I'm going to move ahead and I'm going to talk a little bit about breastfeeding now, because that's our second conversation for today, where we are talking about breastfeeding and getting started. The first question that a lot of mothers might have is breast milk the right choice for me? And if you look at this picture that I have on the screen, it has been put in a golden yellow color. So breast milk is considered to be liquid gold for the baby, and therefore definitely it is the right choice for you and your child. Breastfeeding has a lot of advantages. And when we are looking at breastfeeding advantages, I can actually list 101 advantages, but that's going to take up the entire session and more. So we won't waste our time on that. But some simple benefits that breastfeeding definitely brings to you is that it builds the baby's immunity, it's easy for the baby to digest, prevents allergies, builds the baby's IQ. It also helps you to lose weight, gives you protection against hormone-related cancers, and it's great for bonding. It's super convenient. So breastfeeding has a lot of benefits, and whatever it is, it's worth it to give it the best possible shot more than anything else, right? So give it your best to begin with, and then after, once you've gotten the choice and you've started it off right, then you can decide how you want to take it forward. Here are some quick things that you should keep in mind. The first is ensure that you get started with breastfeeding as soon as possible after birth. If it's possible on the delivery table itself, yes, that would be my first preference. But if not, as soon as you're shifted to your room, make sure you latch the baby on. I'm sure people like, your visitors, relatives will be very excited to meet you, excited to meet the baby, but everybody can wait. And the first thing that you should do is start breastfeeding. Get to know your baby. You have to ensure that the baby is latched on well, which means the baby's mouth has to be wide open and a major portion of the areola has to be in the baby's mouth, right? So the baby's mouth should be wide open. You can encourage this by pulling the chin, compressing the breast a little bit and pushing it inside the baby's mouth. So that will ensure that the baby is latched well. Remember that milk is made in the breast. It's carried to the areola. The nipple is only the excretion point. If the baby latches on to the nipple, the baby will not get milk. The baby has to press on the areola to milk the ducts correctly, right? So this kind of a movement is very, very important as far as the baby's feeding is concerned. Mothers have to sit comfortably. That is very, very essential, right? So make sure that the mother sits comfortably. Your back has to be well supported. Your shoulders should be relaxed. Your, overall posture should be comfortable. The more you feed, the more milk you're going to produce. So latch the baby on often. The recommendation is 10 to 12 feeds every 24 hours. So the more the latching, the more the stimulation, the more the milk production. You also must remember that milk does not start in the first 48 to 72 hours. What you get is very little and it's colostrum. And the baby's stomach size is very small. So it's actually the size of a marble. So therefore, the capacity is less and the milk production accordingly is also much lesser. Some common concerns that mothers have as far as breastfeeding is concerned. So the first is engorgement. So in the beginning, there's no milk. There is nothing being produced. The breasts feel really soft. And then the breasts get really heavy because with all the stimulation, the milk production comes in and the mothers are feeling heavy and hard. This is normal, but it might result in the fact that the baby is not able to latch because the breast is so heavy and hard and tight. So what you should do is put a warm compress. You can take some warm water, dip a towel into it, squeeze it out, and then place it on your breasts. Do a little gentle breast massage, express a little milk, and then latch the baby on. Engorgement is temporary. It will settle down in a couple of days once the feeding cycles settle down. In the beginning, when the milk starts, when you're feeding on one side, you might realize that the other side starts leaking. It becomes feeding time and you start leaking. You can wear breast pads to control the leaking because it's just an embarrassment. Don't worry if after a few weeks this leaking stops. I get many calls from mothers saying, oh my God, my milk has disappeared, and that's normal. But it's not that the milk has disappeared. It's just that now the supply and demand has become nice and equal. So there is no excess which is leaking out. Breastfeeding can cause uterine cramps because it's making your uterus shrink, right? So if you're feeling those abdominal cramps, that's completely normal. And you don't need to worry about it at all. You don't need to be concerned about it. In fact, you should be happy because it means that your uterus is shrinking and you're getting, little by little, you're getting thinner and you're going closer to a flat belly. Sore nipples should not happen. So right from the beginning, take care of your latch. If there is any kind of pain, if there's any kind of discomfort, just make sure that, your latch is correct. Because in the beginning, there'll be a little discomfort. Then it will become painful. Then it will kind of, become, sore. And then there might be bleeding and cuts. And then you don't want that. So take care of sore nipples from the word go. A little bit of tingling in the breast is normal because when the letdown happens and the milk starts gushing down, every time the baby latches on, there's a stimulation on the areola and the breast starts tingling. So you feel as if there are little creepy kind of ants feeling on your breast, and that is absolutely natural. Okay. Many times mothers will report that there are lumps in the breast. So every morning, I would recommend that you do a self breast massage. So the way you do this is start in the armpit, but do nice circular movements all over the body of the breast. And then what you're going to do is strokes like this towards the nipple. Okay? So this is something which should be done every day when you're taking a shower in the morning, and it's a definite recommendation. Okay. If you feel that there is any kind of redness, lumps which are not going, maybe some pain in the breast, then you should immediately report to the doctor, because it could be a breast infection, and we definitely want to attend to it and take care of it. Let's look at some really common questions that mothers have. When will my milk secretion start? The first milk that your baby will get is called colostrum. When the milk comes, it looks a little yellow, and in olden days, this used to be called dirty milk. So a lot of times mothers were asked to just throw it away and then wait for the milk to become white, because that's what we think milk is, and feed that to the baby. But this is very rich in proteins and immunity building factors. It helps to clear up the baby's digestive system, so the initial meconium gets passed out, and eventually it turns to whitish color milk. The more you feed, the faster your milk will start. It generally takes about 2 to 4 days, but if you have a C-section, it can take a little longer. There are 2 types of milk that we generally make. One is fore milk, which comes in the start of a feed, and then there's hind milk, which comes towards the end of the feed, like after a few minutes of the feed. So fore milk is generally thin, it's low in calories and fat. As the baby empties out the fore milk, so the first milk that the baby gets when the baby first latches on, so this happens in every feed, okay? Then comes the hind milk, which is coming behind. It's behind, so hind milk, and that has more fat. If you kind of, do 5 minutes and the baby slows down, and you do 5 minutes and then 5 minutes, the baby is going to get a lot of fore milk. So you should feed longer at each breast once the milk supply has established. So minimum 10 minutes is what is recommended. Maximum can be baby's choice. My general this to mothers is babies can come to the breast for a buffet, but babies can also come to the breast for a drink of water. So as long as baby is feeding adequately for most of the feeds during the day, don't try to time the baby every single time. Should I give only 1 breast or should I give 2 breasts? Right? So sometimes babies may fall asleep after nursing at 1 breast. If that's enough for the baby, that's okay. But you can try to, awaken the baby and feed again from the 2nd breast, because that will do double stimulation for you. And it will also make sure that the baby is nice and full. Sometimes just a burp is needed to remove the extra air, and then the baby is ready to feed again. So that can give you longer gaps between feedings once the baby is a little older. So, when the baby is about 1.5 to 2 months old, and if you get a good, nice 3-hour gap between feeds, you will feel that you have a life. Otherwise, you're constantly feeding. So trying to feed 2 breasts at the same time to ensure that the baby gets a full feed. And this should especially be done for the last feed in the night, which will help the baby to take the first long nap at night. The next question generally is my baby getting enough? And how do you know that? So if the baby is feeding 10 to 12 times in 24 hours, if overall the baby appears alert, is not very lethargic when the baby is awake, content, a little bit of crying is understandable, and gaining weight. So, when you're going to your doctor, the weight gain is adequate. Before a feed, the breast might feel a little tight, but not heavy, but a little tight. But after a feed, it appears a little lighter and a little softer. By the 3rd or 4th day, the baby is having at least 6 minimum soaking wet diapers in a 24-hour period. So anything less than 6 becomes alarming. So minimum is 6. They should definitely cross that. Ideally, we would recommend that you should feed 10 to 20 minutes per side, but you allow the baby to set the pattern. The first 6 months, as per the World Health Organization, is exclusive breastfeeding, which means we give nothing else to the baby. No water, no honey, no cow's milk, buffalo's milk, and whatever other milks that are there, nothing to be given to the baby. The WHO also recommends that breastfeeding can continue along with other solids for about 1 to 2 years into the baby's life. How soon to breastfeed the baby? Obviously, the sooner you start, the better. As soon as the baby is born, if you can latch the baby on, that's great, because immediately at birth, the baby is really alert because the baby is super scared, right? So the baby will generally latch on much better. After that, the baby may sleep for 6 to 8 hours, and this is called recovery sleep. So most hospitals will allow the rooming in, which is great because the baby can be with you and you can understand the baby's cues and signs and signals that the baby is, ready to feed. And the sooner that you learn these things, the easier it is for you to manage when you go home from the hospital. Okay, so I'm going to show you a very quick video related to, one of our benefactors today, which is Cordlife. Let's take a look.
When is a parent born? When your world changes in a moment. Nani? Or when the moment is celebrated by all. When you start learning again. Or with a new role. Is it your child's first breath? Or is it just a feeling? Parents are born when they fulfill a responsibility.
Your child's umbilical cord blood can provide protection from 80 life-threatening diseases. Keep it safe with Asia's largest stem cell bank, Cordlife. One chance, one choice.
Wonderful. So as I mentioned in the beginning, there is a little gift coupon for all of you lovely mamas who are in the session today. This is brought to you by Cordlife and Mom to Be. Mom to Be is a brand which provides accessories for new mothers, expecting mothers, as well as some clothing as well. So if you'd like to indulge in a little bit of shopping, maybe a pregnancy dress or, a pregnancy pillow. So this is the coupon for you. The Cordlife team will be in touch with you in about 48 to 72 hours post this session, and they will be sharing the recording of this session as well as the coupon code. So then you can kind of, do your shopping at that point of time. If you would like to get a presentation and learn a little bit about stem cell banking and whether it's the right choice for you and your family, then you can also book a presentation with them and they will help you out with all the information so that you can make the decision as per your comfort and convenience. This is books by me. I have these 3 books on the market. They are available on Amazon. The first is on prenatal fitness, which is all about exercises during and post-pregnancy, and it has diet charts as well. So we've given you pictures and explanation of each and every exercise. Then there's parenting mantras, which talks about all the little questions that parents have as they are taking care of their baby, from teething to toilet training to initial breastfeeding, vaccinations, everything, right? So it's a quick read and it's available on Amazon. And the last one is Super Mom's Recipes. This is, of course, for when your baby starts eating solids. So you can consider this book for variety. Again, available on Amazon. These are my contact details. I have my website. I also have a presence on Instagram, which is at Sonali Shivlani. And I have a presence on Facebook with Baby 360 Degrees. And I have a YouTube channel, which is called The Pregnancy Coach by Baby 360 Degrees. So make sure that, you like, subscribe, follow, and share it with your friends and family as well who are in the family way. I'm going to open the floor to questions. And what I would also request is while we are answering questions, you can, the Cordlife team can put their numbers in the questions area so that you can be in touch with them as well from your end. So give me a very quick second. I hope you put in a lot of questions for me. All right. So let's start with this. I have the first question, which is talking about which type of exercises help in delivering normally. So ma'am, all the exercises that I've shown you are going to prepare your body for a vaginal birth. But let me specify them a little bit more closely. The first is your squats, the leg raises, the butterfly position, the Kegels, and the deep breathing. But you have to also remember that besides only exercise, there are many other things which contribute to a natural birth. So the position of the baby, the overall health and well-being of the mother, these are all going to be contributors to a normal delivery, right? So discuss this with your doctor so that you are aware of any other pregnancy situations which might be posing an issue with your having a normal birth. Right. So the next question that I have is, what exercise is recommended if there are ovary cysts present during pregnancy? So ma'am, if, this is obviously a question for Dr. Meeta, and she will be answering these questions via email when your voucher is sent to you. So the answer will be provided to you at that point of time. However, if there are no complications, then most doctors will allow you to do all sorts of exercises as long as there are no complications. So that is a question that she can, kind of help you to answer after reviewing your particular case. For swelling in the feet, I showed you these exercises which were point and flex and ankle rotations. Additionally, what you can also do is elevate your feet. So I would ideally recommend elevating your feet to 90 degrees. So you can kind of lie down on a mat close to the wall and you can raise your feet up. So the idea is that it has to go above the heart so that the fluid can rush back for the optimal circulation. So if you have swelling, so for 10 to 15 minutes, you can elevate your feet. One of the things that you should also try to do is soak your feet in warm water, and you can put a little rock salt in that. Additionally, constantly and regularly, make sure you get your blood pressure checked, because edema, swelling can actually mean that, there is some kind of blood pressure issue. So if that is not the case, then it's okay, then it's just circulation. But if there is blood pressure also, then it should be investigated by the doctor. You should not only try to elevate and, resolve the issue there. Okay, practicing chanting of Om is recommended during pregnancy. Absolutely, as long as you're not holding your breath, right? So when we do Om, we take a deep breath in and we, hum it out. That's fine. That's all right, because you're not holding your breath. You're constantly breathing in and breathing out. Which is all right. You can definitely do that. It is also very good to calm yourself and relax your mind. For those who feel that Om is not something that they want to do, you can do the humming. So the Om goes with saying Om, right? And for those who don't want to chant Om because of, their own personal religious beliefs, you can take a deep breath in and just do that. That will give you the same benefit. Okay. Does massaging the breast with bio oil from second trimester help with breastfeeding? No, it does not. There is nothing that you can do during pregnancy which is going to help with breastfeeding. However, applying a little bit of bio oil or any other oil with vitamin E will help to prevent stretch marks on the breast, because the breast size is constantly increasing, right? So that is something that is going to be helpful in terms of ensuring that you don't get you don't get stretch marks on your breast. But no amount of breastfeeding. One additional caution that I would recommend is please ensure that you don't do nipple stimulation during pregnancy, because excessive nipple stimulation can result in preterm contractions, and that's not something that we want. So no nipple stimulation, but gentle massage is all fine for preventing stretch marks. So besides, while I'm waiting for more questions, besides these, social media options that we've already listed on the screen, I'm going to share a WhatsApp number with you. So you can make a note of it. It is 7666360 360. So I will just put it as an answer in one of the messages. So 7666360 360. This is on WhatsApp. Yeah, it's being put as a message. Make a note of the number. You can drop a WhatsApp message to this, and we run a free pregnancy tips group. So you will be added to the group. Just send a WhatsApp saying add me to pregnancy tips, and my staff will take care of that. So I'm really happy for any more questions. Would anybody like to ask any more questions related to what we have covered today? If you'd like to share any feedback on this session, we'd be really happy, because that's a learning experience for us as well. All right. So it looks like, all the questions are done. We still have a couple of minutes. I would love to get feedback on the session. I would also like to say a very big thank you once again to Dr. MEETA NAKHARE for giving us the opportunity to speak to all of you lovely mamas. I hope the session has been helpful and worth this Saturday morning for you. Another thank you for Cordlife for helping us to organize this platform. So thank you, Dr. MEETA. Thank you, Cordlife. And just last couple of minutes, if there are any questions, I'll be really happy to take them. Otherwise, you can definitely address all your medical questions. The doctor will take care of that, via email post the session. And you can stay in touch via Instagram, etc. also. So that's an alternative that you have. Thank you so much. That's amazing feedback. It makes me feel awesome. Right. So so gentle massage of the breasts is definitely welcome. As far as the inverted nipples check is concerned, it's definitely recommended that you check for inverted nipples during pregnancy, because it will help in ensuring that breastfeeding is taken care of. And you can do the nipple exercises after you reach your 37th week, because after 37 weeks, if labor were to start, then it is okay. It's full term. But in early pregnancy, from 28, 30 weeks and etc., doing excessive nipple stimulation might pose to be, maybe you might end up with a little bit of this. So the concept of inverted nipples, just to touch upon that, this is what a flat nipple would look like, and a normal nipple is like this. So when you apply a little bit of ice or you tease the nipple, if the nipple stands out, then you know that you don't have an issue. But if the nipple appears a little flat and it's not protruding and it kind of looks as if it's pulled in sometimes, then that can be a cause for concern. Not that you're not going to produce breast milk, you will, but it will be difficult for the baby to latch on. So when the nipple is nice and formed and the baby latches on, the baby gets a good grip on the back of the palate with the nipple. But if the nipple was flat and the baby latches on, the baby's mouth will keep slipping, and that becomes a challenge. Yes, some amount of nipple discharge is expected during pregnancy, sometimes after even in the third trimester. If it's a little bit, it's okay. But if it's excessive and you find that you're starting to soak, then you should let your doctor know, because during pregnancy, progesterone keeps the milk flow in check, and progesterone also helps to ensure that your pregnancy is supported and you don't go into preterm contractions. But if progesterone levels are dropping very rapidly and you have excessive fluid discharge, then this could be a warning sign. So a little bit of discharge is very normal. Some mothers may not get it at all, and that's normal too. It's not a reason to feel that I'm not producing breast milk or I'm not going to produce breast milk after delivery. So little leaking is normal, and excessive leaking should be reported to the doctor. Gentle breast massage in the entire body of the breast is welcome, but excessive nipple stimulation should not be done. All right, so I'm experiencing pain in the sacroiliac joint on the left side, particularly, and extends to the groin region when I change sides while sleeping. Okay, so ma'am, what you're experiencing is what we call pubis bone dysfunction. During pregnancy, the pelvis expands to support, the entire pregnancy and the baby and etc. So keeping that in perspective, this is normal. But for some women, this expansion is a little more, especially in this lower region. So the expansion is a little more. And then this can cause the discomfort. So first, I would recommend that you meet with your doctor and you discuss this so that it can be identified correctly and not just like a random conversation like this. And if it is, then 1 or 2 sessions with a physiotherapist to learn the right exercises so that you can kind of, strengthen that area a little more is definitely worth it. All right, so I actually have Dr. MEETA on the chat. She has joined in as an attendee rather than, in this. So one of the recommendations that she is giving is that you should do a gentle abdominal massage. A lot of mothers want to apply vitamin E based oils to prevent stretch marks. So apply a little bit of oil, but do it very gently and don't do circular movements. Just do gentle oil massage without any pressure on the abdomen. All right, thank you so much. Thank you, MEETA ma'am, for all of those lovely inputs. We would have loved to have you speak, but the inputs were very, very welcome. Thank you for your time. Thank you for giving us this opportunity, and we look forward, at least I look forward to doing more sessions for you and your mamas. So thank you so much. Moms, I would love to see you on my social media. I would love to have you on my free tips group. So please make a note of the number 766360 Send a WhatsApp and we'll add you. Thank you to the Cordlife team, and they will be in touch with you for the coupons and the recording of this session. Thank you everybody for joining us on this Saturday morning. It's been an amazing session, and we look forward to many more. Thank you. Have a great day. Have a great weekend, and a very happy new year to all of you. So have a great year ahead.
When is a parent born? When your world changes in a moment. Nani? Or when the moment is celebrated by all. When you start learning again. Or with a new role. Is it your child's first breath? Or is it just a feeling? Parents are born when they fulfill a responsibility.
Your child's umbilical cord blood can provide protection from 80 life-threatening diseases. Keep it safe with Asia's largest stem cell bank, Cordlife. One chance, one choice.